The American Medical Association Minority Affairs Section, in collaboration with the Commission to End Healthcare Disparities, is pleased to present the Physician Interview Project. Did you know that only 7% of all U.S. physicians are African American, Hispanic, American Indian, Native Hawaiian, or Alaskan Native, while almost 30% of the patient population are from these racial and ethnic groups? By analyzing trends among minority physicians as to what helped guide them to their career paths, the Physician Interview Project aims to uncover specific determinants that have proven successful in assisting minority students towards a successful career as a physician. We hope you will be inspired by these 11 physicians.
I decided to become a doctor probably when I was about 13 or 14, which is pretty young. I think most people don't know what they want to do when they're 13 or 14 years old. But around this time in 1995, when I was about 12 years old, my mother became diagnosed with non-Hodgkin's lymphoma. And it was, I didn't really understand what was going on. So about a year passed and I just saw her health just deteriorate. She was spending months away at clinics, hours away. My dad was the only one who was caring for me with the help of church members. And I just remember being just really confused about what was happening with her body and with her health. And nobody was really explaining it to me in a way that I understood. And I think if you take that and, normal 12, 13-year-old raging hormones, it just was a very troubling time. But I'm pretty sure that that's where my origin and interest in medicine stems from. And I think this is pretty much cultivated. When I was 13, I had a librarian at my middle school who asked me, well, what do you want to do when you grow up? And I said, I think I want to be a doctor. And she told me about this physician pipeline program, which actually started when I was 13 years old, and I was in for the next, 10 years of my life. So that was basically, like I said, cultivated my interest in medicine, but it definitely stems from what happened with my mother and just watching her condition worsen and actually improve, and just wanting to know why it was like that and what the doctors do, what were those medicines doing, what helped, what didn't help. That led me to want to be a doctor.
When I was making the decision to enter medicine, there were three major factors that guided that decision. The first was my pediatrician. He had a way of making all his patients feel special. When he walked into the room, it was as though you were the only patient he was seeing that day, and that stuck with me. The second factor was an experience I had during my summer before my senior year of high school. I had the chance to go to a medical school and spend 3 weeks with other minority students who were interested in medicine, and I had a very positive experience. The last factor was just the fact that as a doctor, you get the chance to make a meaningful, positive impact in people's lives. Oftentimes, as a doctor, when you meet people, they're having one of the worst days of their life. And you have the chance to help them heal not only physically, but mentally and emotionally.
I decided to become a doctor when I was in high school. It was probably my interest in knowing how my body functioned. And I happened to have gone to one of these conferences. It was for pre-med students. And there was a medical student there who actually talked about the function of the human body. And so I kind of wanted to know more about the human body because of me. I wanted to know what my liver looked like. I actually wanted to know how my nervous system functioned. And that was the beginning of my interest in medicine. As I went along studying science, I did take physiology in high school. I took some mathematical courses. I took calculus. I took trigonometry. But then as I went to undergraduate college, I became even more interested in medicine because of healthcare disparities. And looking at my neighborhood and looking at the disease processes that affected my neighborhood more so than other neighborhoods. And I thought, how can I make a difference in terms of these disease processes that were occurring in my neighbors across the street, my family members, my cousins, my aunts and uncles. So my interest in medicine started because of my interest in my own body and the human body in general. And then after becoming more interested in just the function of organs, I became interested in how a physician actually decreases disease processes that might, how a physician can actually teach patients how to take care of themselves and how the role a physician played in terms of preventive.
I sustained my interest by participating in programs that helped me work in the hospital. In high school, I worked through the radiology department. I worked through the pharmacy and saw friends and relatives in my community get help. I also was a part of a program called Commissioned Officers Externship Program, and I was a second lieutenant in the Public Health Service. I think being a part of those programs allowed me to understand what some of the benefits are from being a physician.
Along the way, I did have probably my teachers that helped sustain me in high school with their encouragement of pursuing my dream. In college, I did have an excellent pre-medical advisor who also encouraged me in applying to the best medical schools, even ones I did not think I could get into. Also, when I was in college, I met my future husband, and he was always a constant support as well. My family also was very supportive of me in this dream. Again, not really knowing any physicians or even having any in the family was not something that detracted me from this dream.
During high school, I remember very clearly interviewing a physician who lived in the neighborhood. He was an orthopedic surgeon, and he actually allowed me to go on rounds with him one Saturday morning. I remember he showed me some of the tools of the trade that he used as an orthopedic surgeon, and I also remember that he gave me a copy of the Journal of the American Medical Association many years ago, and I remember reading it over and over again and trying to understand those big complicated words that were in the journal articles. During undergraduate in pharmacy, you know, we were constantly involved in learning about various illnesses and conditions, and certainly that fed my interest in medicine, and that really helped a lot. During medical school, certainly I've never worked so hard as I did, especially during the first 2 years. But I knew that in order to get to the clinical years, the third and fourth years, I really needed that preparation of classroom work. And in spite of the fact that it seemed to be very removed from the clinical practice of medicine, I knew that I needed that background work, and it allowed me to remain focused on the ultimate goal.
My great aunt was a nurse in New York, and I remember talking to her as a young child, I think probably around the age of 4 or 5, about my interest to become a physician, and she thought I should consider a career in nursing. I told her I didn't want to be the nurse, I wanted to be the doctor. I felt as though the doctor was the one that the patient looked to readily for answers about their health and their family's health. That's something that I think has sustained me throughout my career as a resident physician, as I go out and pursue a career being an internal medicine pediatric physician.
Well, during high school, again, the same thing. I did a lot of reading about doctors and about lives of doctors and the history of medicine. I tried to take courses that were appropriate for that, and I got very interested in biology and things like that. And I also, during high school, try to meet physicians and try to see what they did and try to spend some time in their offices and try to learn something more about the field of medicine. In Colombia, we don't have a college per se. We go straight from high school to university. So as soon as I finished high school, I went immediately into medical school the first year.
Financially, I have the privilege of having my parents pay for my medical education. However, I had to be very responsible and very smart in terms of managing a budget. It was challenging for me. Even though you spend a lot of money in medical school, yes, the money you spend there is definitely worth it.
Well, during college, I worked. I worked a lot. I worked maybe 20 hours a week during college. I also did have some scholarships and a lot of loans. For medical school, I started off with a lot of loans and again, a few scholarships. But I extended my time in medical school, so it took me longer than 4 years to get through medical school. Because of that, I was racking up a lot of loans, and so I decided to take the Indian Health Service Scholarship. This is a scholarship that's available to everybody, but Native Americans do get preference. I received that scholarship for 3 years, and they pay for tuition and books. And so it was extremely helpful. You then owe them a year. For each year that they fund you, you owe them a year. Well, I've been at South Central Foundation here in Alaska, which is a Native health corporation, for almost 7 years. And so I did my payback and I stayed, and I really don't have any plans to leave the Indian Health Service or Native health at all.
I think, like many college students, I didn't have a lot of money. I probably had less than most. I think I just got through that time period of college by being as frugal as I could and just having a very, very modest lifestyle. For example, I lived on campus for 4 years, and I think just being in general very, very frugal with a very modest lifestyle. In medical school, it was pretty much a continuation of that modest lifestyle that I had become very accustomed to in college.
Thank you for viewing these videos. We hope you heard something that motivates you towards a career in medicine. To view the entire interview from each doctor and to learn more on how you can help increase the number of minorities in medicine, visit www.ama-assn.org/go/Moz.